We are going to see next 25 to 50 questions of the UPSC CMS paper 1 2024 answers with explanations. This is about the cluster headache. The headache is periodic and beginning at the same time at for a week stretch. Periodic feature concerns the identical X beginning at the same time for a week. Patient experience severe unilateral periorbital pain 30 to 90 minutes. Unilateral periorbital pain 30 to 90 minutes and features of the ipsilateral theory nasal congestion. This is also a subcutaneous injection. Sumatriptan or inhalation of 100% oxygen may be beneficial in halting acute attacks. So the option D is correct answer. '27 question. A 22-year-old lady presented with complaints of chronic daily headache. She has prior history of migraine but increasingly unrelieved with analgesics. She has a history of using sumatriptan also almost daily. Using sumatriptan or other triptans 15 to 20 days per month that leads to the medication overdose headache. Okay, triggering factors of the seizures. Flickering lights is there. Recreational drug misuse. Non-compliance treatment of the anti-epileptic and sleep deprivation. So all of the following are lead to the triggering factors of the 1, 2, 3, 4 triggering factors of the seizure. The 75-year-old man present with the temporal headache, jaw pain exacerbated by the chewing and tongue. This is temporal arteritis or giant cell arteritis. The gold standard investigation is temporal artery biopsy. The Roy and Biner staging is used for chronic lymphocytic leukemia. Patients suffering from which of the following condition commonly present with several years in the dermatology OPD with the eczematous or dermatitis skin lesion before being finally diagnosed with T-cell lymphoma. T-cell lymphoma before stage is mycos fungoides. Oral anticoagulant dabigatran. All others are the subcutaneous injections or intravenous injections. Autoimmune hemolytic anemia treatment. First, in autoimmune hemolytic anemia, we go for prednisolone low doses. Patient not response, high dose glucocorticoids. Patient not respond, then we go for rituximab. Patient not respond, then we go for splenectomy. Almost every patient with response for splenectomy. Causes of secondary hyperaldosteronism. Secondary hyperaldosteronism causes inadequate renal perfusion due to diuretic therapy, cardiac failure, liver failure, nephrotism or renal artery stenosis. The option is inadequate renal perfusion due to the renal artery stenosis. Which of the following diseases is characterized by destructive lymphoid infiltration of thyroid gland leading to fibrosis and enlargement of thyroid with an increased risk of developing thyroid lymphoma is renal thyroiditis or otherwise known as fibrosing thyroiditis. 52-year-old diabetic patient with recurrent episodes of hypoglycemia. This is the keyword. And BP is also high. Antihypertensive choice. Which of the following antihypertension should be avoided? Patient with diabetic mellitus plus hypertension, the antihypertensive choice is ACE inhibitors or ARBs. The avoided one antihypertensive is propranolol beta blocker because it shadows the symptoms of hypoglycemia. This question is very doubtful question. 37 question is very doubt. In 38 question, the 65-year-old female is stone cutter. Stone cutter is a keyword. And nodular opacities in upper and middle zone chest X-ray and mediastinal lymph node showing axial calcification is silicosis. Complication of acute pancreatitis is hypoxemia, hyperglycemia, and reduced serum albumin, not hyperglycemia, hypoglycemia, because sequestration of calcium in fat necrosis that leads to the hypoglycemia, not hypercalcemia. So option 1, 3, 4 is answer. Gold standard diagnosis for celiac disease is endoscopic small bowel biopsy. Small bowel means duodenal biopsy. With regard H. pylori eradication in peptic ulcer disease, consider the following statements. Proton pump inhibitor is taken, 2 antibiotics. Yes. Treatment is prescribed at least 3 days. This is correct answer. Patient requiring long-term NSAID should undergo H. pylori eradication therapy. Yes, is correct. Treatment of H. pylori infection leads to vitamin B12 deficiency. This is not. Treatment of H. pylori infection it leads to prevent the vitamin B12 deficiency and iron deficiency. Option 1 to 4 is answer. Which of the following precipitating factors of hepatic encephalopathy? Hypovolemia is there, septicemia is there, and increased dietary protein load. So all of the following are leads to the precipitating factor of hepatic encephalopathy. Which of the following is correct regarding the upper GI bleeding? Esophageal varices is most common cause. No. Peptic ulcer is most common cause for upper GI bleed. Eradication. Okay. Patient with cardiovascular disease who are on aspirin for secondary prevention should not reach. Aspirin should be continued to the patient with upper GI bleed. Tips should be considered as a therapy only after 1 week of hospitalization for acute variceal bleeding. This is not. The eradication of H. pylori in patient with bleeding ulcer decreases the rebleeding rate less than 5%. This is the correct answer. Grigler-Najar syndrome type 1 is autosomal recessive disorder. Whipple's disease is characterized by infiltration of small intestinal mucosa of foamy macrophage. Foamy macrophages means fat inside the macrophage. Fat stained by Sudan black B. Poorly absorbed antibiotics are often used as adjunctive therapies in patients with the hepatic encephalopathy. Antibiotic. Tenofovir is antiviral, sofosbuvir is antiviral. These two is antibiotic. Most commonly used antibiotic in hepatic encephalopathy is rifaximin and neomycin. SAG criteria less than 1.1. SAG criteria less than 1.1 is infection and malignancy. Cardiac ascites and portal hypertension more than 1.1. A sigmoid configuration along with tapering, peak-like deformity at the lower esophageal sphincter on barium swallow is a feature of achalasia cardia. Bad peak-like deformity in barium enema. Allergic contact dermatitis is a delayed type of hypersensitivity reaction. Which of the following is an example of non-scarring alopecia is tenogen effluvium. All others are scarring alopecia. Thank you.